The stabbing of the Ukrainian woman in North Carolina on the train is not a crime crisis, it's not a race crisis. This is a mental health crisis that we are having in America. The 28-year-old woman who came from Ukraine to USA for a better life was on the train when she sat behind a schizophrenia patient, okay? She sat there, he pulled out a knife and stabbed her unprovoked. Stabbed her multiple times, right? And then he got off the train as if nothing ever happened, where he was met by police and was charged with first-degree murder. This is a mental health crisis that we are having in America. 34-year-old DeCarlos had at least 14 arrests since 2014, okay? His last bid was a 5-year sentence. He came home earlier this year where his mom said that he was being aggressive. So aggressive she had to kick him out of the house. DeCarlos started to experience hallucinations where he called the police on himself. After calling the police on himself, he had an involuntary commitment order. This is a document where a patient who is having a mental health crisis is ordered to go to a mental health facility against their will. The judge was then supposed to order him to a competency evaluation, which he never went through with. They never did it, so he was just a man out here with the schizophrenia crisis on the street with regular civilians, and this is how it ended up happening. Schizophrenia is one of the most disabling mental health crises, yet it is the hardest to treat. With disrupt thoughts and perception, they have a difficult time separating what is real and what is not. The Carlos family is blaming the justice system. They are saying that people are using this as a racist and biased situation instead of looking at his mental health crisis. They even opened up a GoFundMe to help with his legal fees, but the GoFundMe eventually shut his page down. But let me tell you something. 41% of people in prison and jail have a mental health crisis. 1 in 4 people in prison and jail have some sort of mental health crisis. And the COs that work in these places, they are not equipped to help these patients. If anything, the jail could actually trigger them. It could trigger them, make the symptoms worse, and then when they are released on the streets, you get results like this. Patients that are going through schizophrenia, they have to be in a mental health facility. They have to be treated by professionals. Schizo patients are usually prescribed an antipsychotic drug along with cognitive therapy. But when you are in prison and you are having episodes, they are more worried about your physical health than your mental. They will strap them up, okay, and put them in a hole, which is confinement. Take them away from the general population. This can make symptoms worse. This can